the number of affected people have increased tremendously, moving from 4 early June to 316. And the trend is very worrying. And because it's worrying, we decided that we have a meeting, both national government and county government, so that we come up with some decisions. So far, a total of 316 people from Kakamega County here have been infected, the statistics that we have locally. Of those, 154 are still in hospitals. Some have recovered, and we have lost 7 people in this county. Out of the 316, 57 are our health workers. We had 3 sites for isolation: Mumias, the General Hospital here, and Lukuyani. Now Mumias is full. Mumias that had a capacity of 61 beds, we have moved that to 91, stretched it to 91. And then the balance of the people are here at the General Hospital, and we have activated Lukuyani. Now Lukuyani, we have 10 patients there. Because of ICU facilities are only at the General Hospital, it forces us to bring critical patients now from either Lukuyani or Mumias here at the General Hospital, because these other hospitals do not have ICU facilities. We have decided that we actually activate Manyala Hospital in Butere sub-county. It should be also an additional isolation center, and Mautuma Hospital in Lugari. We still have problems with testing, because the testing still happens in Kisumu, and it takes a day or 2 to get the results. We have always appealed to the national government to support this county in view of the population, so that we have our testing center. And because of these numbers, I think it is very critical that we build designated a testing center. The medical waste in Mumias, it doesn't have a incinerator. So we are forced to transport the medical waste to the General Hospital, which is a distance. And we are forced to do the same from Lukuyani to here. We have decided that we shall have a incinerator at Mumias, shall start construction of one in Mumias. At times we have a shortage of water. This county is a water deficit county, despite the many rains we have here. And we keep on experiencing shortage of water. We have requested the parastatal in charge of water, Kakamega Water Services Company, to pull up their socks so that places that water is supposed to be, like hospital markets, we must make sure that those places have water. We have a shortage of manpower. So we have agreed in these facilities that I've named, Manyala, Mautuma, Lukuyani, the County General Hospital here, we are going to recruit on casual basis more staff so that they are able to help us in fighting the disease. National and county governments to intensify enforcement to ensure that wananchi adhere to the laid down protocols and restrictions. All enforcement officers, including the police, should ensure that people at business premises, including market shops among others, and passengers using matatus, wear masks. And all learners in public institutions or learning institutions should also wear masks and maintain social distance. Some of our staff here have been found with COVID. And we have now agreed that all staff at the headquarters here and all other staff should be tested. And because we have a higher number of headquarters staff here affected, we have agreed to close down the headquarters here for 7 days, effective tomorrow. We will only have essential services staff here who will be able to respond to emergencies, especially the finance staff. All headquarters account staff will undergo COVID test immediately.